Hi, it's Tawny again. I decided to do another video before I see my surgeon. In my first video I mentioned I don't see my surgeon until the 12th of February. I wish I saw her sooner. This process really couldn't get started soon enough for me, and that's part of why I wanted to make another video. I guess it's kind of an outlet for me to get some of this like pent up energy out. And so basically what is going on is I have gotten almost kind of obsessive about thinking about how it's gonna be to be skinny, what recovery is gonna be like. I just have a million questions, and I'm kind of over analytical that way. I always wanna know exactly how things are gonna go. I wanna plan everything, micromanage, I guess. And so I'm pretty much driving my husband insane. I think he's tired of hearing about it already. And so we've got a long way to go still. One of the things that I have thought about a lot, you know, I wasn't always a heavy person, but I've been overweight for about 6 years, and I've really kind of gotten this like fat girl in the corner type mentality now. I used to be really outgoing and really ambitious, and I just don't necessarily feel that way anymore. I don't like drawing attention to myself, I guess. I don't, you know, I'm overweight and I don't like really being in the center of things. And so, but it wasn't always that way. So, I guess my question to everybody who has done this surgery is, when you lose the weight, do you end up, I mean, does the way you feel about yourself change, or do you always kind of feel like the fat girl? You know, it's like my main thing is all my friends are skinny pretty girls, and I am always the fat friend. And I remember that was kind of, it hit me really late. You know, for all the years that I've been overweight, it hit me really late to realize that I was no longer the pretty friend, I was the fat friend. You know, I was not the one that men would approach. I was, you know, I just was more of, I don't know. I just was the fat friend. And so, I mean, I don't really know how else to put it. And I wonder if that changes. I wonder if somehow when I lose the weight, all of a sudden I'm gonna be back to what I was before I was overweight. It's scary to think that I won't be. It's scary to think that somehow I'm always gonna have this mental block that says, you know, I'm not comfortable in my own skin. And so there's just some issues that I'm dealing with like that. I'm kind of turning this into a big stress ball. But I found a group or a forum on my phone that is called Vertical Sleeve Talks. And it's basically just a forum of people who have gone through the operation, that are getting ready to go through the operation, that have had success, that have had complications. There's just all kinds of, you know, thousands of posts that you can go through. And I'm like losing sleep going through this app every night when I get off work, just like so excited to read everything that, you know, I want to know everything. I want to know the good and the bad and the hard recoveries, and, you know, not thinking or not having the surgery not turn out like you thought it was going to. I really just want to know everything so I can go into this with my eyes wide open. So that's been a really resourceful group, and I thought I would mention that on here. The next thing is that I was kind of curious about is pregnancy. I kind of wondered how your body okay, so I know you have to wait a year after surgery to try to start getting pregnant. And what if, let's say I am able to get pregnant, which would be a miracle, how does your body recover from the pregnancy weight-wise after that? Does it come off like it did when you got the surgery? Or, you know, is it slower? Is it like any normal person trying to lose the pregnancy weight? I mean, I just want to know how difficult, I guess, it's going to be if I am able to get pregnant to get my body back to what I got the surgery for in the first place. I've had really large breasts my whole life, and that's another thing that my husband and I discussed recently is, you know, men love breasts, and so not to get too graphic, I guess, but I don't want to be self-conscious about the way my breasts look after I lose weight, because they've been so large. I'm concerned that with losing the mass, they're going to be very saggy. And I would like to know more about, you know, how women deal with that sort of thing. Are they getting breast lifts or augmentations, or you know, what is the best result for that sort of thing? Not that I want to run around showing my boobs off, but, you know, I like having large breasts, and my husband likes it, and so I would like to have nice breasts if I'm gonna have a nice skinny body. And so, like I said in my first video, I weigh about 218 right now. I've lost a couple pounds recently. We've had some really stressful family situations going on, and so I've actually lost a couple pounds, and I'm curious about how much weight, you know, can you really fluctuate and have them still say you're okay for surgery? Right now, I'm at a 41 BMI, and so obviously I have a little wiggle room because the center that I'm going to for my surgery says that you have to be at least 40, and I think my insurance does too. And so I was kind of wondering if anybody's really had any problems with possibly losing too much weight, because like my insurance requires that I see specialists for my weight for 6 months before they'll give me the surgery. And, you know, it's like, if I lost 15 pounds, am I no longer eligible? I mean, how does that kind of thing work? I'm not really familiar with that. And these are all questions that I'll direct towards my surgeon once I'm able to see her. Which I'm really, really excited about. She is a world-class surgeon, and the center that she works out of in Portland, Oregon is also world-class. Surgeons come from all over the world to train with her, and I'm just really, really excited about it. She's done over like 3,000 vertical sleeve surgeries, and so really, really exciting. I think if you go to anybody, then she is definitely the right person in Oregon. And so everybody's been really accommodating at that center, and you can always contact me if you're in Oregon about that information, and I would, you know, be willing to share the doctor and the center that I'm going to. So my last thing, and I'll try not to make this so super long, I know they get boring. My husband is considering weight loss surgery as well. My husband is a really, really big man naturally. He's about 6'5", and at his healthiest weight, he weighed about 310 or 320. So, and that's thin and muscle bound for him. He's just very big, and he has developed type 2 diabetes, and he's about 100 pounds overweight right now. So he's just over 400 pounds. 400 pounds, you know, to me sounds like a huge number, but to see it on him, it's just not as massive as it sounds, I guess. Either way, he is eligible for weight loss surgery as well. And he was considering getting the gastric bypass, I guess. Type 2 diabetics have a lot of success with that surgery. And, you know, I've already started this process. I've already seen 4 doctors. at that weight loss center that I'm going to in Portland. And I wonder if anybody's had an experience where their husband does it with them. You know, recovery, how is that? You know, we don't have any kids, so it's not like we have kids to take care of during our recovery. But is it easier to go through it together? Is it harder? You know, eating habits, I think, would be easier to get, you know, synchronized and in the right guidelines if both of you are doing it. So I'm just kind of curious about that. So once again, I really, really want some feedback from everybody. I'm going to plan on posting lots more videos. Probably I won't do another one until I see my surgeon on February 12th. Sorry, February 12th. And so I will talk to you guys again soon. I'm really excited. Thanks for listening. Bye.